April 9th, 2019, next to the Mohawk River. 29-year-old Daniel Denoyer sat in his car for hours. He superglued his seatbelt shut and posted his final message on Facebook. "I'm saying goodbye. This world wasn't meant for me." A minute later, he drove into the river and drowned. Daniel had 2 wonderful kids and recently started to recover from depression. So what exactly was it that pushed Daniel to his final breaking point? $20. You see, Daniel relied on Fidelis Care, his insurance company, to cover the cost of risperidone, an antipsychotic medication for his mental illness. But just 2 weeks earlier, when he went to pick up his prescription, he discovered that Fidelis discontinued his coverage because he missed a $20 payment. Daniel immediately called Fidelis and paid the $20, praying that he can now get his medicine, but Fidelis said they wouldn't cover it until next month, leaving him with 2 options. He could either pay $250 for risperidone today or go without it for a month. But you see, Daniel didn't have much money. He didn't have a couple of $100s just laying around. So out of desperation, he chose the latter. Unfortunately, Daniel's story is just one of millions who can't afford the medicine they desperately need. But what if I told you Daniel's medicine is sold for just a fraction of the price right outside the United States? What if I told you Americans pay 3 times as much as people in other countries pay for the exact same thing? You see, when I tried to figure out why this is, I was shocked by the amount of deception and manipulation that goes on right in front of our eyes. This is the dark reality of Big Pharma. So you live in the most powerful country in the world, economically, militarily, and geographically speaking. So it's safe to assume that you have the best healthcare in the world, right?
But the one thing that stands out is that among all major developed nations, it's pretty clear that the United States comes in dead last.
And this is despite spending more on healthcare than any other country on Earth, a point that will be very important later in this video. Let's say you have diabetes and you need insulin to survive. In the US, it'll cost you $98.70. In Australia, $6.94. What about Humira, treatment for Crohn's disease? In the US, $2,984 for a syringe. In the UK, 1/7 of the price at $410 for just about any medication you can think of. You have to pay significantly more than anywhere else in the world. Why? Well, like in any market, what determines the price of a product can be simplified to 2 things: a buyer, the insurance companies, and a seller, Big Pharma. The more leverage the buyer has, the lower price they can get it. In the United States, insurance companies are fragmented. There are hundreds of them scattered across the country with every American on a different plan, meaning no one insurance company has enough leverage to request lower prices, which gives Big Pharma all the power to overcharge. While this is only a simplified example, this uncovers the true power of Big Pharma in the United States. And it turns out, this is only the tip of the iceberg. You see, all Big Pharma has to do after they create a new drug is get FDA approval, decide on a price, and then profit. It doesn't matter if the drug is barely an improvement to what's already available. It doesn't matter if it's insanely expensive. It just doesn't matter. Because Big Pharma knows they can freely charge you, the desperate, the sick, and the dying, however much they want. Because, well,
there is absolutely nothing in the US healthcare system to stop drug companies from setting high prices and then increasing them whenever they want.
Take Zaltrap, for example, a colorectal cancer drug released in 2012. The cost of its treatment? $11,000 a month, double the price of its competitors. So you'd at least imagine it was twice as effective or had half the side effects. But no, doctors looked at the data and said it offered no added value. It is no better, but it still cost twice as much. But you might be thinking this is just an anomaly, something that just slipped through the cracks, but it gets worse. This is Diapreme, a treatment for toxoplasmosis, a parasitic infection and the second leading cause of foodborne illness deaths. Without treatment, you can go blind, have seizures, a brain infection, and die. On August 9th, 2015, Diapreme cost $13.50 a pill. On August 10th, a company called Turing Pharmaceuticals, led by this man, Martin Shkreli, former hedge fund manager, pharmaceutical owner, and officially named the most hated man in America, acquired the exclusive US rights to the drug. A few weeks later, on September 17th, Martin Shkreli jacks up the price of Daraprim from $13.50 to $750 a pill, a 5,000% increase. The starting dose for adults who need this treatment, 1 to 2 pills a day, lasting around 2 weeks. So now you're looking to pay up to $21,000 for a treatment that used to cost $378. And when asked why he did this, Martin Shkreli had just one response: "It's a great business decision," and then called the person who asked a moron. Look, I'd love to tell you that this was it, that price hikes don't happen often, but
An investigation into the cost of prescription drugs reveals huge price hikes over the past 5 years. Several brand name medications more than doubled in price.
Cycloserine for tuberculosis used to cost $500 for 30 pills, now $10,800. Doxycycline for bacterial infections used to cost $20 a bottle, now $1,849. Isuprel for cardiac arrest used to cost $215 for a vial, now $1,346. Okay, so where am I going with this? You see, Big Pharma knows that if you're sick, what choice do you have? You need the medicine to stop hurting, to stop the pain, to survive. So even if it buries you into more debt, even if it causes you to steal, you will do anything you can to get the next dose, because the other choice is death. But who cares, right? All these price hikes are just sticking it to the big insurance companies. Those greedy corporations will cover most of the cost anyway. Well, not really, because all the increases in cost are passed back to you, the people. There's a reason why your insurance premiums go up every year, even though you receive less coverage. And there will always be some unlucky few who would have to pay for these drugs out of pocket because they don't have insurance. But what if I told you there is another way, a better way that'll make drugs cheaper for you? There's a reason drugs in other countries are cheaper. And again, it all boils down to this: the buyer and the seller, Big Pharma. Remember, in the United States, insurance companies are all fragmented, so no one company has any leverage. However, in other countries like Canada, the process is completely different. In Canada, Big Pharma negotiates with just one entity, the Canadian government. And that government entity represents every single Canadian, granting them enormous leverage over drug prices. So this sounds like a perfect system. Have the US government step in to negotiate drug prices all at once. But there's just one big problem, with consequences that impact every single person in the world. So you're an investor in the United States. You have $20 million that you're looking to grow. You can either invest in a tech company or a pharmaceutical company. But let's switch it up and say the US government now negotiates drug prices and can get them for much cheaper. Perfect, right? Americans are healthier, happier, and everyone wins. Except you. Since drug prices are now cheaper, your potential profits are lower. You won't make as much money, so you're no longer interested. And instead, you invest in the tech company. You heard the saying before, money makes the world go around. And it's the same exact story with prescription drugs. Once you remove the attractive price tag, fewer investors will be interested, leading to less research, fewer drugs available, and fewer diseases cured. And not just in the United States. This goes way beyond our own borders. Because the United States pays such high prices for drugs, it actually helps fund the world's drug research. Without the US spending, the world could see deteriorating health conditions, new diseases, lower life expectancy, and significantly more deaths. But what if all this is a lie? What if this excuse is exactly what Big Pharma wants you to think? What if we don't have to sacrifice innovation for accessibility? You see, Big Pharma loves to justify their high prices by saying they need the money to research and develop new drugs, all for the greater good. But did you know it's actually you, the taxpayer, who pays for this research?
You lie to patients when you charge them twice as much for an unimproved drug, and then you lie to policymakers when you tell us that R&D justifies those price increases.
So you've got this representative who is confronting this guy called Richard Gonzalez, the CEO of a Big Pharma company.
The Big Pharma fairy tale is one of groundbreaking R&D that justifies astronomical prices. But the pharma reality is that you spend most of your company's money making money for yourself and your shareholders.
Check this out. 7 out of the 10 big pharma companies spent more on sales and marketing than on research and development in 2020. For one, Johnson & Johnson spent $22 billion on sales and marketing and only $12 billion on research and development. So let's get this straight. Most of the money big pharma makes from you buying their drugs is spent on making you buy more of their drugs.
And the fact that you're not honest about this with patients and with policymakers, that you're feeding us lies, that we must pay astronomical prices to get innovative treatments is false. The American people, the patients, deserve so much better.
But what this representative fails to say is that you, the American people, are actually getting screwed twice. Almost 2/3 of new drug patents and 3/4 of drugs in late-stage development comes from researchers at universities and small companies who receive their funding from philanthropies, grants, and you. Your tax dollars through the National Institute of Health. You have been funding the research for every new drug approved between 2010 and 2019. But that's not even the worst of it. After your tax dollars are used to discover these drugs, Big Pharma swoops in, buys the drugs, get FDA approval, slaps their logo on it, and then turns around to charge you and the government sky-high prices for the very same medicine you paid to discover. It's the same story time and time again. Zoloft, bought up by Pfizer in the 1970s. EpiPens, bought up by Pfizer 2000. Genotropin, bought up by Pfizer 2003. Uptravi, bought out by J&J 2017. It's estimated that if the US government stepped in to make drugs cheaper, reducing Big Pharma's revenue, there would only be 2 fewer new drugs in the next decade. And those 2 new drugs might not even be really new. Remember when I talked about Humira, a treatment for Crohn's disease? In 2003, it cost $522 per syringe, and now it costs $2,984. Surely, after 2 decades of monopoly patent protection, there would be cheaper generics. But remember this man, Richard Gonzalez, the CEO of AbbVie, the company that owns this drug? He has done everything in his power to stop generics from happening, because Humira, this single drug, contributed to 36% of the total company's revenue in the past quarter. And Richard Gonzalez knows that if cheaper generics are made, AbbVie's stock price will be decimated.
We have a system here in the United States where you can keep filing the same patent over and over and over again, even if it's rejected by the patent office, and it becomes a war of attrition.
So is this a deliberate attempt to stifle competition?
Absolutely.
Since 2003, AbbVie has filed at least 257 new patents in the United States for Humira, with virtually meaningless changes. Different dosages, different needle sizes, different mediums of application, all in the name of keeping competitors out in exchange for more profit.
If you could rewind the clock a few months, I wonder if you would do anything differently.
So you have this journalist asking Martin Shkreli, the man who raised the price of a life-saving drug by 5,000%. She's asking if he would change anything, now knowing that people have died because they couldn't afford the treatment.
I probably would have raised the price higher, is probably what I would have done. I think healthcare prices are inelastic. I could have raised it higher and made more profits for our shareholders, which is my primary duty. You know, this is a capitalist society, capitalist system, and capitalist rules, and my investors expect me to maximize profits, not to minimize them or go half or go 70%, but to go to 100%.
But he's right. People forget, big pharma companies are for-profit, public companies owned by shareholders and investors. And these companies need to maximize profits to keep their investors happy. Big pharma does not function for social good, and you can't blame for-profit companies for trying to make a profit. That's why they exist. So you're left questioning the entire system that created this situation in the first place. The system, as it stands now, virtually requires big pharma to charge high prices for drugs.
I understand why patients are frustrated because they need these medicines and they can't afford them. But I would urge you to recognize that the system itself is complex and it is interdependent. And no one company can unilaterally lower list prices without running into financial and operating disadvantages that make it impossible to do that.
It incentivizes big pharma to suppress the creation and sales of generic drugs, to push addictive drugs to patients, to keep their research a secret, and to release something, anything, even if it's not an improvement, as long as it can be patented and profited from. But how much profit is ethical for a company to make at the expense of the sick and dying? Capitalism doesn't have any ethical or moral limits on profit. It allows most companies to make as much money as they want, as long as their customers are willing to pay. However, the issue with something like medicine is that patients are willing to pay anything, because the alternative is death. Look at it this way. When you decide between eating a burger or a hot dog for lunch, you're not going to die regardless of which one you pick. But that's not always the case with medicine. Everyone needs some form of healthcare to survive. And when forced to decide between paying or dying, people will try their hardest to pay, even if it means taking on endless amounts of debt. And because Big Pharma knows people will pay, they can make the price whatever they want, because those who can pay, even if barely, will make up for any losses from people who can't. And the fact that Big Pharma tries to put themselves on this holier-than-thou pedestal, that they're charging these high prices because they're selflessly reinvesting their profits into curing the world's diseases, and they're doing all this out of the goodness of their heart, is quite frankly disgusting. Just looking at their financials and the fact that Big Pharma executives are some of the highest paid in the country shows otherwise. If you're going to maximize profits at the expense of the sick and dying, at least own up to the reason instead of making up some bold excuse. Look, I don't think Big Pharma shouldn't be able to make profits, but there has to be a middle ground. A scenario where the industry as a whole makes just enough profits to keep them in business and innovative, but allows for prices to be affordable enough so that people aren't just scraping the bottom of the barrel to just stop hurting, to stop the pain, to just survive.
Pharmaceutical industry is powerful. Pharmaceutical industry loves their profits. A lot of Americans have pharmaceutical industry stock in their portfolios. They want to see big profits because it helps their retirement.